Thank you very much for introduction of me. The title of my presentation is Inhibitory Effects of Long-Term Repeated Treatment of Sustainable GnRH Antagonist, degarelix acetate, on caprine testicular functions. First, let me talk about the introduction. The surgical castration of male food animals is performed to make them docile, to improve meat quality, or to prevent the meat from damage. In companion animals, it is done to avoid pregnancy or to suppress problem behaviors. Chemical castration has been introduced as an alternative method since the surgical castration has drawbacks such as necessity of anesthesia and the possibility of post-operative infection. It has been reported that sustainable gonadotropin-releasing hormone, GnRH, agonist and antagonist, and GnRH vaccine are used as a chemical castration. The GnRH antagonist inhibit luteinizing hormone, LH, and testosterone secretions by inhibiting binding of endogenous GnRH to its receptor. The GnRH antagonist has an advantage with rapid suppression of LH and testosterone secretions over GnRH agonist and GnRH vaccine. A sustainable GnRH antagonist, namely degarelix acetate, has been used as a drug to treat prostate cancer for men because it suppresses testosterone secretion for long term. We have reported previously that blood concentration of insulin-like peptide 3, INSL3, and testosterone were reduced for 2 months by a single injection of the degarelix acetate, and those hormonal concentrations were recovered after 2 months of the treatment. However, effects of repeated treatment of the sustainable GnRH antagonist for long term were unclear for function and morphology of testis. So, objective: in order to examine whether a sustainable GnRH antagonist, degarelix acetate, can be used for chemical castration in goats, we investigated effects of long-term repeated treatments of the antagonist on testicular hormonal secretion, size, ultrasound image, histology, and spermatogenesis. This slide shows the material and methods. We used 4 male silver goats. Their ages were 3 to 6 months of age at the start of experiment. We used a sustainable GnRH antagonist, namely degarelix acetate, at 40 milligram per 10 kg body weight, were given subcutaneously every 4 weeks for 7 times in total. 1 week after the 7th treatment, ochiectomy was carried out and testis and epididymis were collected for the following experiment. This slide shows the schedule of measurements of scrotum circumference, testicular ultrasound examination, and blood collections. Scrotum circumference measurement and testicular ultrasound examinations, indicated as green, were performed weekly during the experiment. Blood samples, indicated as red, were taken every day for initial 5 days, and 7 days after the first treatment, and thereafter weekly. We used other 4 male silver goats as a control group. Their ages were from 9 to 12 months at the same time, at the time of ochiectomy so the ages were same as the treatment group. We collected testis and epididymis after the ochiectomy. Just before the surgery, we measured scrotum circumference and examined the testis by ultrasound and compared the data with treatment group. This slide shows the ultrasound examination of testis. Probe was placed on the caudal scrotum vertically to the long axis of testis and the same image. We selected two regions circled with 5 millimeter diameter like this for each testis under the mediastinum testis. This is the mediastinum. Measure the density of testicular parenchyma using an image analysis software, ImageJ, and expressed as grayscale intensity. This slide shows analyses of testis and epididymis of goats. After the ochiectomy, testis and epididymis were separated. Testis was weighed and processed for histological examination, and area of seminiferous tubules were measured. Epididymis was also weighed and homogenized, and the number of sperm was counted. I'm going to show results from this slide. This slide shows the changes of plasma testosterone concentrations in goats treated by the GnRH antagonist. The plasma testosterone concentrations decreased significantly on the next day after the first treatment and were maintained at very low level until the end of the experiment. This slide shows the changes of plasma INSL3 concentrations in goats treated by the GnRH antagonist. The plasma INSL3 concentrations decreased significantly 2 days after the first treatment and were maintained at lower levels until the end of experiment. This slide shows changes of scrotum circumference treated by the GnRH antagonist. Mean value of 4 weeks data is shown during 6 months in the GnRH antagonist treated group as a blue bars. The data of control group just before the ochiectomy is shown as a red bar. The scrotum circumference decreased significantly 2 months after the first treatment of the antagonist. The scrotum circumference further decreased during the 6 months and showed 30% of reduction compared to the just before the first treatment. The scrotum circumference at 6 months after the first treatment was also significantly reduced compared with the control group just before ochiectomy. This slide shows the ultrasound image of testis in goats treated by the GnRH antagonist. The testicular image 6 months after the first GnRH antagonist treatment looks darker than that before the first treatment. It looks darker than that of control group also. This slide shows the changes of grayscale intensity of testicular image in goats treated by the GnRH antagonist. So the mean value of 4 weeks data is shown during 6 months in the GnRH antagonist treated group as a blue bars. The data of control group just before the ochiectomy is shown as a red bar. The grayscale intensity decreased significantly 1 month after the treatment and gradually decreased until 6 months. The grayscale intensity at 6 months after the first treatment was also significantly reduced compared with the control group just before orchiectomy. This slide shows testicular histology of the control goats. Left picture indicates that the seminiferous tubules are well developed and the spermatozoa and spermatids are observed. Right picture shows the normal Leydig cells in the interstitial tissues. This slide shows the testicular histology of the GnRH antagonist treated goats. Left picture indicates that seminiferous tubules are underdeveloped and both of spermatozoa and spermatid are not observed. Right picture shows that atrophied Leydig cells in the interstitial tissue. So this slide shows the results of analyses of testis and epididymis of goats. In the GnRH antagonistic treated goats, testicular weight and epididymal weight and seminiferous tubule area and seminiferous luminal area all are reduced in the GnRH antagonistic treated group compared with control. In the GnRH treated goats, sperm number in the epididymis was 0 and lower than that of the control group. So conclusions. The secretion of plasma testosterone and INSL3 concentrations decreased within a few days after the first treatment of degarelix acetate, and these secretions remained inhibited for 6 months due to the effect of monthly repeated treatments. Grayscale intensity of ultrasound testicular image reduced at 1 month, and the testicular volumes declined at 2 months after the first treatment. The suppression of spermatogenesis in seminiferous tubules and absence of sperm in epididymis were confirmed at 6 months after the first treatment. Thus, repeated treatment of the long-acting GnRH antagonist are an effective chemical castration method for goats. Thank you very much.